Welcome to Emergency Cardiology. Today I'd like to introduce you to Dr. Martin Lowe. He's going to talk to us today about atrial fibrillation in the lecture series, and I've asked him to give us a brief introduction. Martin, can you tell us a little bit about yourself?
Yes, I'm a consultant electrophysiologist. I've worked in the field of arrhythmias and I started at the Heart Hospital in 2003. So I've spent 7 years working with patients who develop arrhythmias.
Tell me why you think it's so important for emergency doctors to understand about atrial fibrillation.
Well, arrhythmias are a very common presentation for patients to the emergency department, and atrial fibrillation is the commonest arrhythmia. So most patients with arrhythmias will present with atrial fibrillation, and the treatment is actually crucial for those patients, because the wrong treatment, the patient ends up in a much worse condition, but the right treatment, the patient is treated successfully and is able to go home.
And tell me about the things that you're going to approach in your lecture today.
Well, the two main themes are a discussion of what the most appropriate strategy is for patients who present with acute onset of atrial fibrillation. And they revolve around two issues: whether we should go for rate control, in other words, accept the patient will remain in atrial fibrillation, but treat them so that their ventricular rate is adequately controlled, or whether we should adopt a rhythm control strategy, aiming to terminate their atrial fibrillation so the patient goes home in sinus rhythm.
Martin, that's fascinating. I look forward to hearing your talk today. Thank you very much for joining us.